Hi, I'm Paul Kautza. I'm the Director of Education for the Data Warehousing Institute. We're here in San Diego, California for our World Conference and also our Executive Summit. And I'm joined today by Dan Gerena,
yes,
who is the Director of Business Intelligence and Analytics for Kaleida Health in Buffalo, New York.
Thanks for
joining us, Dan.
Thanks for having me.
You gave a presentation yesterday at the Executive Summit, and I was just wondering if you could, first of all, just give us a little bit of background of Kaleida Health and kind of lay out the scope of what you were trying to accomplish, what you were doing.
Well, sure. Kaleida Health, we're in Western New York, where we have a 5 hospital healthcare system, so 4 adult hospitals and 1 pediatric hospital. And we have about 70 or so off-site clinics, we have labs, we have skilled nursing facilities, and a visiting nursing association. So we essentially cover the whole breadth of healthcare coverage from birth to what happens at the end there. So we see about 1 million patients or so a year. We have about 62,000 inpatient discharges. And we have about 10,000 employees and $1.2 billion in revenue. So that gives you some sort of idea.
Pretty good size operation.
Sure, it's decent size, yeah.
So what were you trying to accomplish in the you was talking about scorecards and dashboard and
Correct.
we were talking earlier.
Sure.
What were you trying to accomplish with your project, and what were the challenges you were facing that caused you to do it to begin with?
Well, we have, over the past few years, we've built a very robust and deep, in terms of breadth, data warehouse. So we have information from pretty much every system, clinical, financial, all the operational systems, HR systems. So essentially what our challenge as an organization was that we had so much information, how do you make it tangible and digestible to the average bear manager who has so much to accomplish throughout the day from a tactical perspective. So our challenge really was trying to determine what the best way to deliver this information was. Historically, we've been report-centric, but the problem with that is you log in as a manager and you see now a list of 100 reports because you have that much information accessible to you. So essentially what we did during our project is we've developed a visual data dashboard where we put some structure around that content. So instead of having a listing of 100 reports, essentially we were able to put metrics in their own buckets. So we had a balanced scorecard approach. We had financial, operational, quality, and staffing metrics. So everything fell into one of those 4 components. And so we developed visual dashboards around each of those 4 components. So as a manager now, as you log in, you see those 4 components, and you know if you want to look at overtime utilization, for instance, you'll go to your staffing dashboard, and you can see that trended over time for the most recently completed pay period and on a year-to-date basis. And naturally, we built behind all of that the ability to drill down to the employee level, for instance, in that particular case, to understand what's driving overtime, where you have issues, what shifts, that sort of thing. So that's what our initial objective was. Apparently, I guess we were successful, so we were asked to sort of tell our story today.
So was this more employee-driven data? Was it patient outcome data? How broad was the data you looked at?
This is essentially everything. So not only do we have employee-level data in terms of all of our internal 10,000 employees, so that's all represented on the staffing dashboard, but we also have a lot of operational information. So for every patient, we're able to look at length of stay and acuity. That's the overall sickness of the respective patients. We're able to look at the supplies that went into the care of those patients and look for variation amongst different physicians doing the same type of procedure. We're able to look at financial metrics such as variances from budget. So it also quality indicators, patient falls, mislabels, mortality rate. So it really covered everything you really need to monitor to manage a complex organization like a hospital system.
So did you deploy those dashboards through different technologies? Did you do mobile technology on any of them, on iPads or
At this point,
Androids,
our initial rollout, we're using Oracle products. So the initial rollout was just really they access it through their desktop application. We have about, at this point, 1,200 or so users, and that goes from the executives down to the managers, down to back office staff that need it to consume information on a daily basis to their daily jobs. So at this point, we're just looking at a desktop deployment via our intranet. When we promote to the 11G version of our tool set, that's when the mobile capabilities will be pushed out to the executive team. So right now, as far as mobility goes, we do have and leverage the ability to push alerts out to key individuals when certain thresholds are exceeded or on a scheduled basis. But we're hoping to incorporate some mobile technology in the future.
Terrific. You also mentioned, when we were talking earlier, you did some things in the dashboard design, dashboard development that allowed you to make changes fairly quickly through the process. Can you describe that a little bit and how you structured that, what that looked like?
Sure. Well, the way we approached it was we've been maintaining a data warehouse for a good part of 8 years now. And even though we're new on the particular tool set, our warehouse itself is pretty mature. So we've spent a lot of time building out the data warehouse such that all of the existing relationships were predefined. So, for instance, we have a fact table that looks at the individual patient activity, and that's joined to all of the procedures, all the diagnoses, all the physicians, whether they're the attending, the referring, the surgeon. So we have there's a complex web of information that we can get to from any particular starting point. So we invested a lot of time building that out. So what that allows you to do is, when you have that structure already in place, and something that needs to be addressed quickly arises, you're able to quickly get to that. So, for instance, about 2 years ago or so, when we're embarking on actually deploying the tool set, the dashboard tool set that we're speaking of now, at that time, if you recall, a big H1N1 scare. And so we were about, in a matter of 3 or 4 days or so, we were able to develop a full view of how many patients were arriving in our emergency departments with those symptoms, how many employees were calling in because of those symptoms. So we had about a 360-degree view of that particular issue, and we were able to turn that around quickly because we had all of the data pieces in place. So the structure that we had worked on had allowed us to become agile, essentially. So whatever the new, whatever arises tomorrow, we'll be ready to do it based on the fact that we're already established and have that foundation.
Just out of curiosity, what size of database are you looking at? Is it, how much data? What kind of history are you keeping?
We try not to archive too much data because it can get, depending on the source system that we're pulling from, we don't want to be we want it to be more of a what's going on now or in the last 2 years, 3 years. So we try, and fundamentally, healthcare changes so much that when you look at certain elements of information 5 years ago, now we're doing those procedures via a robot, or we're doing them as an outpatient status because we're doing them laparoscopically and not slicing someone open. So the nature of healthcare is such that things change, that oftentimes if you see an apple today, it really was an orange 5 years ago. So we try not to worry too much about archiving data, except if it's a certain type of metric like inpatient discharges or outpatient encounters, things of that nature. So we try to keep what we feel is relevant as from a time perspective as possible. So I think we're a little under a terabyte or so with all the information we've got going on.
Terrific. Well, that's very interesting. And healthcare, as rapidly as it's changing, as rapidly as going with all the potential new regulations coming on the pike, the better platform, the better level playing field you have, the quicker you can react, and that's really interesting. So what do you see for your organization and what you're doing over the next couple of years? What are the next major things you're looking at?
Sure. Well, we've just recently in the hospitals implemented an electronic medical record. So prior to that, a lot of information lived on a piece of paper in a file. And so the introduction of electronic medical record means that I will now have access to information that historically I've never had access to. That means we can look at things from a global perspective and look at the efficiency of certain medications if they're given within X amount of time. We can support some research from our physician perspective. We're going to have a lot more granularity in terms of what was done to a particular patient, in what setting, by whom, and what those outcomes were. So really it's going to make everything I've done to this point look like spring training. That's when the real fun actually happens, when we actually get our hands on that data. And that will keep us busy for a while. Everything essentially is going to be codified and available electronically.
That's really, and you probably wouldn't be able to get there nearly as easy if you didn't have the foundation in place that you have today.
Yeah,
so.
I mean, essentially, we were just warming up for this. So,
Well, terrific. Well, that's very interesting, and I think as the healthcare field keeps changing and growing, this will keep changing and growing as the rest of the industries do. So I appreciate your time today, Dan. And if you need more information, you can go to tdwi.org or information-management.com. I'm Paul Kautza with TDWI. Thank you very much.